Intro. It's a myth that you can just use a positive airway pressure device for 10 days and get used to it. If you're using it the wrong way, you won't get used to it. It's important to have a good understanding of how a positive airway pressure device works, and to try different things to find the best way to use it. For example, if the mask doesn't fit or the pressure isn't right, tolerating it won't help you get used to it. You need to know how to do it right. In this video, I'm going to show you how to find and adapt to your pressure on your own, without going to a doctor's office for a polysomnogram or a positive airway pressure test. I spent a lot of time making this video, and I want to help people avoid the trial and error that I went through. I'm not a doctor, so if I'm wrong, please let me know in the comments. Chapter 1. My history. I've tried everything related to snoring, surgery, a positive airway pressure machine, an intraoral appliance, and sleeping on my side, and they all failed. Surgery. I am a thin person with a small jaw, which is why I snore. In 2005, at the age of 25, I underwent snoring surgery at an otolaryngology clinic in Jeonju, South Korea. For surgeries, inferior turbinate resection, adenoidectomy, tonsillectomy, and septal curvature were performed at once. Although it was very painful, the surgery was successful. There was a side effect of regurgitating water into my nose when I drank it, but my snoring was completely gone. However, 10 years later, the snoring started again due to the stretching of the uvula. That's when he started looking for a cure for snoring again. Positive airway pressure failure. I failed to adapt to a positive airway pressure machine in 2019 because I used it without realizing it was broken. Thinking that my patience was weak, I fell into self-pity. I bought a ResMed S10 Autoset used it in automatic mode. There was no pressure change on the inhale and exhale, it kept pumping at the same pressure. I thought that was the way all positive airway pressure machines worked at the time. I tried to adapt, but my lungs continued to swell and my breathing became life-threatening, so I gave up. Intraoral devices. I believe an intraoral device is superior to a positive airway pressure machine. I have used both a positive airway pressure machine and an intraoral device. They are uncomfortable to wear and need to be cleaned, but they are easy to clean. They are easy to use. If you move your mandible forward a lot, you may experience jaw joint pain, so you should only move it forward a little. You'll have to compromise with mild snoring. It's mainly used for mild sleep apnea. I had a good experience with an oral appliance. However, in my case, my gums were weakened due to 5 years of orthodontic treatment. The appliance worked well for my snoring, but it took a toll on my front teeth. I felt pain in my front teeth, just like when I had braces. My dentist advised me not to use the appliance due to suspected root resorption side effects. I stopped using them. Sleeping on your side. I don't snore when I sleep on my side. However, it is impossible to sleep on my side continuously. It's uncomfortable, so I decided to find another way. Retrying the positive pressure machine. All failed and I fell into a state of anxiety. After failing in 2019, I saw that many people were able to adapt easily, and I thought that I should study more about positive airway pressure. I vaguely suspected that it was not that I lacked patience, but that I was doing it wrong. I studied positive airway pressure since the fall of 2023, bought an old Philips BiPAP positive airway pressure machine secondhand on the internet for $100, completely disassembled and cleaned it, replaced the hose, and replaced the mask. I tried it on pressure 6 and it was a new world. Within 2 minutes of putting it on, the machine adjusted the power of the motor according to my inhalation and exhalation. It was completely different from the one that failed in 2019. It was easy to breathe. From this point on, I would like to share my experience of studying and trying various things. Here are some tips to help you get used to using a positive airway pressure device. Chapter 2. 3 cases of nasal problems. Before using the positive airway pressure, rhinitis and nasal congestion, after ENT treatment. Use the humidification function after using the positive airway pressure, if you have dryness or nasal congestion. If you do not have these symptoms, it is not recommended to use the humidification function. It requires a heated hose and may compromise hygiene. See narrow nasal passages or deviated nasal septum. If you have narrow nasal passages, you should use high pressure. If you feel tightness when you breathe through your nose normally, you have rhinitis or a narrow nasal passage. You need to have an inferior turbinectomy to widen your nasal passages. If you have a severe deviated nasal septum, you'll also need surgery. These are two of the easier surgeries. Chapter 3. Finding the inhalation pressure. A. How to find the minimum pressure. The reason why leakage is a problem is because it causes the rhythm of the positive airway pressure motor to change. When air leaks out of the mouth, it is perceived as inhalation and creates a strong pressure that conflicts with the user's exhalation. This causes the user to have difficulty breathing and remove the mask. A similar problem occurs when the mask leaks. One way to prevent air from leaking out of your mouth is to tape it shut, but this is inappropriate. With the right amount of pressure, the uvula presses against the root of the tongue, so that even if you open your mouth, no air comes out. When you speak, the air comes out of your mouth. Within 5 seconds of stopping speaking, you should feel the air coming out of your mouth blocked by the uvula. This is the minimum pressure. If the pressure is too high, breathing is uncomfortable, and if it is too low, there is no improvement in sleep apnea. Pressure adjustments are usually made while lying down. If you try to adjust your pressure after you've fallen asleep, it will disrupt your sleep. B. How to find your maximum pressure. Check your AHI sleep apnea index in the morning after using your CPAP machine. You can find it on the screen of your CPAP machine. An AHI of 5 or less is normal. If the AHI level is high, sleep with the pressure up a notch, and check if this AHI level is low in the morning. Repeat the pressure adjustment until this figure is below 5. If you exceed this pressure, you will have difficulty breathing and there is no difference in sleep apnea effect. This will take about a week, as you will need to check your AHI every morning. If your AHI is higher than 100, you may need to use a CPAP after surgery for an anatomical abnormality. The usual pressure range is 6 to 10, with CPAP, BIPAP machines starting at pressure 7. If you are obese, you should diet. C. Your stomach is full of air. It is believed that mouth breathing causes gas in the stomach, but this is incorrect. It's a matter of the esophageal sphincter and pressure. There is an upper esophageal sphincter and a lower esophageal sphincter. Weak sphincter plus pressure of 10 or more equals air in the stomach. Stress, alcohol, smoking, obesity, and the habit of lying down immediately after eating can weaken the esophageal sphincter. Bad habits should be eliminated. Do not use a positive pressure machine with automatic pressure. Use it as a fixed pressure. If the AHI level increases after use at pressure 7, a compromise must be found. The EPR setting is recommended as 3. More on this in chapter point 4. If you're still getting air, try a different manufacturer's positive pressure, or give up on the positive pressure and use an oral appliance. Chapter 4. If you don't feel comfortable exhaling. A. Reduce pressure. Reduce the pressure or choose a mask with more vent holes. B. EPR. The EPR/response/flex function is to set the pressure difference between inhalation and exhalation. A setting of 3 is recommended. For example, if you set the inhalation pressure to 10, the exhalation pressure will be 7. The minimum exhalation pressure is 4. Set your EPR to 3, and set your inspiratory pressure to 5. Your exhale pressure should theoretically be 2, but your inspiratory pressure minimum is 4. It's not going down anymore. C. BiPAP. They say they use BiPAP when they have central sleep apnea or when they need high air pressure. BiPAP. It is also useful if you find it difficult to breathe out. Manufacturers do not promote these advantages. CPAP. With APAP, the exhaled pressure is only 3 lower than the inhaled pressure. For example, if your inhalation pressure is 20, your exhalation pressure will be 17. However, BiPAP allows you to specify the inhalation and exhalation pressure separately, so you can have an inhalation pressure of 20 and an exhalation pressure of 4, which significantly separates the pressure difference. BiPAP is not a product with great technology. It's just the expiratory pressure setting has been added. The manufacturing costs seem to be similar, and I think the 2 to 3 times higher retail price is a marketing bubble. In the BiPAP setting, IPAP is inhalation and EPAP is exhalation. D. Change your mask. Very few people adapt to full face masks. Nasal, pillow masks are the majority. People who have used a positive pressure machine for a long time prefer a pillow mask. The disadvantages of nasal masks are that they cause nasolabial folds and skin allergies. However, for pressures above 10, you should use a nasal mask. Pillow masks can only be used at pressures below 10. Pillow masks are easy to put on and offer sizes S, M, L in one product. Because of this, the pillow mask is easy to fit on the nose. When using a pillow mask, we recommend that you start with a size L to begin with. Once you've tried the L size, you should only go down a size if you have a lot of air leakage. The smaller the size of the pillow mask, the more resistance there is to exhalation. Many people overlook this important fact and fail to adapt. If the mask leaks, it will be perceived as an inhalation and will generate strong pressure, which will disrupt your breathing rhythm. Small leaks are irrelevant. However, large leaks change the motor rhythm of the positive airway pressure and cause breathing difficulties. It's important to make sure your mask is leak-free, and a leak rate of 30 is average. You can check your mask for leaks with the smartphone app provided by the pressurizer or on your PC with the free Oscar program. You can download it by searching for Oscar CPAP on Google. Chapter 5. Headache. A. If the mask has a blocked exhalation outlet, a headache occurs due to carbon dioxide. If it is blocked, remove foreign substances. B. It could be a headache from the smell of a new product in the hose and mask. Let's leave it on for 24 hours instead of using a positive pressure machine. C. If you get a headache even after adapting to it for 10 days, lower the pressure 1 and try it. Chapter 6. Eye bloodshot. A. If you feel pressure on your eyes or have congestion, suspect an increase in intraocular pressure. The higher the pressure of the positive pressure machine, the higher the intraocular pressure. It is necessary to check whether the intraocular pressure is excessively high in the ophthalmologist. High intraocular pressure causes glaucoma, but sleep apnea also causes glaucoma. Sometimes you need to use a drug to lower intraocular pressure. A better way is to use a positive pressure device under low pressure after an otolaryngological surgery. B. If your eye movements are stiff and bloodshot, it is dry eye syndrome. If the wind goes from the mask to the eyes, adjust the position or size to prevent the mask from leaking. Chapter 7. Soft start. This function gradually increases the pressure at low pressure. After falling asleep, the set pressure is reached. It is a function that helps you adapt to CPAP. Please feel the difference in on-OFF for the soft start function. Chapter 8. Hose hanger. To prevent hose tangles caused by tossing and turning while sleeping, buy a hose hanger or fix it in the air using a smartphone holder. It is a method of fixing the hose using a wire to the smartphone holder. The cost is low on the smartphone holder. Chapter 9. Strengthen your breathing muscles. Different people have different breathing muscles. The lungs contract and relax differently. If your breathing muscles are weak, you will feel stuffy when you use a positive pressure machine. In this case, you can adapt if you wear a positive pressure machine for 2 to 3 hours in normal times, for about 10 days. This is because the breathing muscles are strengthened. Chest muscle pain can also occur. It occurs because you breathe with a stronger force than usual. After about 2 weeks, the muscle pain disappears. Only when you've taken all the steps described above, you should try to adapt for more than 10 days. If you try to adapt in a misused state, you end up failing.